Breast reduction is physically making the breast smaller by specifically removing some of the bulky gland of the breast, which is the kind of the milk-producing part of the breast, and that's to physically make the breast physically smaller. Every breast reduction does also include a breast lift, so it's essentially impossible to remove some of the bulk under the skin of the gland part of the breast without also then removing some of the skin and tightening things up. The main techniques are, which people refer to as a lollipop lift or a vertical breast lift. That's where there's a final scars around the areola and then down to the crease of the breast. The really big downside to that particular type and technique of breast lift is that patients are still left with a ton of skin touching skin in the crease of the breast, whereas the technique that I use, which is called a wise pattern breast lift, essentially does include the anchor scar. So there's the scar around the areola and then down the front part of the breast, and then also out to each side. The benefit of that, though, is that even with larger breast reduction patients, they usually have little to no skin touching skin here in the breast crease. It gives a much better overall shape of the breast and gives a significant amount of lift to the breast, as well as, again, removing as much volume or bulk or heaviness of the breast, usually as much as the patient wants. One of the limitations of a breast reduction procedure can be that sometimes patients who have really large breasts and have had them obviously their whole life, essentially, a lot of times patients want to make a huge reduction in the breast. There is a limitation to how small I can get the breast in some cases, but most of the time patients are crazy happy with this amount of reduction and, again, how much lift that they were able to obtain with a breast reduction procedure.